there is life after HIV.
You realize that there is life, that you can continue.
Watu sahi wananikubali, hata sahi tunakula pamoja na watu.
Nyanya naona maisha imebadilika.
Over time, people living with HIV and AIDS have come out to speak openly about the reality of living with the condition. This public disclosure has significantly contributed in reducing stigma and discrimination, besides proving to be a powerful tool in breaking the silence. It has also helped individuals overcome fear and prejudice. In Kenya, statistics show that women are at a much higher risk of becoming infected with HIV and AIDS. This scenario is attributed to a number of factors, key among them being social injustices perpetuated by the patriarchal systems in the society.
For every 5 Kenyans who are infected, 3 of them are women. And women also suffer a lot of injustice because of our patriarchal systems in the community, so that they are not part of the decision-making instruments in the community. And ideally, they have no one to protect them. And that is why the project focused on women and children, because of their vulnerability.
Previously, the fight against HIV and AIDS was for long hampered by many obstacles, including negative traditional beliefs, some of which linked it to witchcraft. Many of these obstacles have since been overcome through communications and outreach programs led by the government and the civil society. One such institution is the Women Fighting AIDS in Kenya, WOFAC. The organization has since 1993 given support to women who have experienced rejection, stigmatization and discrimination as a result of being affected or infected by HIV and AIDS.
In 1992, I attended a meeting in Amsterdam for HIV-positive women. And this really encouraged me to come up with a group of women in Kenya that would support other HIV-positive women, because I remember the time I was diagnosed, it was more or less a death sentence. So when I attended this conference, it actually encouraged me.
Monique Tondowi, a mother of one, is a living testimony of the unique challenges that people living with and affected by HIV and AIDS have to contend with.
When I came to WOFAC, I found that there is space for me to express myself better. I felt I could talk freely. These are people, you meet other women, you meet other people living with HIV who have not disclosed to someone else. You have this secret and burden you are carrying over and over, and every time the community, your friends, you hear how they talk about people living with HIV, and here you are, you already know your status, you are wondering, are these the right people I should disclose to? So really this was a space where I could be able to express myself, where I could cry and laugh. I mean, I felt like HIV has really destroyed my life, like I have no future anymore. But coming to WOFAC, talking to others, you realize that there is life, that you can continue, that HIV is not the end of the world. And the first thing I realized, actually, what is killing people is silence. And if I start talking, then I think I can be able to help many more.
Action Aid International Kenya is involved in a unique project that is supporting women and children who are living with HIV and AIDS or are affected by HIV to live a dignified life.
This particular project has seen a journey of women and children. Women being able to move from the moment when they know their HIV status, who have been able to overcome stigma as a result of the interventions that this project has undertaken, and have been able to move on with their lives. They have been able to engage in businesses, they have been able to engage in farming, and also change the attitudes of their community, that HIV AIDS is not a strange disease, it is a disease like any other. They have been able to overcome that stigma.
ActionAid International Kenya is partnering with WOFAC on a unique initiative in Bumala in Busia County.
We have one project that is being undertaken in Bumala, which is in Busia County. The project is titled Supporting Women and Children who are living with HIV and AIDS or affected by HIV to live a life of dignity. In the implementation of this project, we partner with ActionAid partners with WOFAC, and ActionAid plays the management role, and in that, ActionAid does the planning, preparing the budgets, and also doing monitoring and evaluation. And besides that, it also takes the role of advocacy. WOFAC is the implementing partner in the area, and WOFAC's implementation will include basically working with women and children to ensure that they are able to access HIV prevention services, they access care and treatment, because most of the women that we work with and most of the children that we work with are may not be able to afford health, and sometimes we may not be able to access even just simple prevention tools.
The project's key activities include food baskets for child-headed households and old guardians, vocational training for older orphans, and seed fund support for women living with HIV.
This project began because in this region there are a number of cultural practices that are harmful and that increase the risk of HIV infection. We have wife inheritance, the high number of women who are widowed in this particular region, and they have suffered some injustice. Some of them have been disinherited, from their homes after their husbands have died. And then we have a large number of orphans. The program has also put a number of older orphans who find themselves heading their homes on in training, and that means that they have been, they are able to sustain themselves so that they are not reliable. They are not relying wholly on what the project is providing.
From the far-flung village of Jera in Nyanza comes an inspiring story of resilience and determination. Helen Mandela, a widow and a mother of 4 children, triumphed over despair and hopelessness after benefiting from the seed fund with a startup of 4,000 shillings which she invested in a vegetable business.
Area hii mimi ndio nilikuwa wa ugonjwa wa virusi kwanza. Area hii yote. Hata mama wamekufa na hiyo ugonjwa lakini hawakuwa wanajua. Lakini mimi bwananga alipokufa walijaribu kunifukuza hata kwa bomu. Kusema ya kwamba wewe malaya umetoka huko Nairobi na ugonjwa. Ni wakati nilikuwa napeleka hii vitu kwa nini? Kwa sokoni. Watu walikuwa nakataa kununua kwa sababu walikuwa wanasema huyu ako na ukimwi atatuambukiza. Watu sasa hivi wananikubali, hata sasa hivi tunakula pamoja na watu, hata sasa hivi biashara watu naona watu wananunua kwa sokoni. Hata hapo nyumbani naona tuko pamoja sasa. Naweza ongea na watu. Ukiona mtu amedhoofika mwili kabisa, usiseme ni malaria, amerogwa nini? Hakuna kurogwa siku hizi. Siku hizi mwenyewe uende kufanya nini? Uende upimwe, utarudi sawa. Kama mimi. Hebu niangalie saa hii niko na jembe, ninatoka kulima saa hii. Vitu yangu mimi najihusia, siombaombi mtu.
Viona Waridi is 21. She's among 14 girls who benefited from a hairdressing course and now works at a salon in Kibera in Nairobi.
Saizi maisha naona ikiwa sawa sana. Naona ikiwa sana. Sasa ni ile tu sasa nijipange tu. Si mbaya sana. Juu ile ilikuwa ngumu sana. Wewe ungeweza kunywa uji ya muhogo bila sukari na haijamixiwa hata na mahindi hata na mtama. Watu wa WOFAC nashukuru sana. Nashukuru sana maanake wamenitoa mbali. Singekuwa hapa kwa wakati huu.
We work with the youth in schools, both in and out of school, to ensure that actually we change their behavior before they are infected. But for those who are already infected, we support them with whichever way they want.
Traveling to the remote Ligingo township, it was clear how timely interventions could change lives. Joseph Osewe, a 23-year-old orphan, is a beneficiary of the vocational training program. He successfully underwent computer training and now earns a modest salary, allowing him to support himself and a guardian, his aged grandmother.
mimi sikuwa nimejua OFAC. Sasa wenye tulienda kwa hiyo ofisi just through the assistant chief, ndio alitupeleka kwa hiyo ofisi, alafu tukaambiwa here we have some people here, they are training people on vocational training. So alitupeleka huko ndio nikajua OFAC, so wanasaidia orphans. Sasa ndio walinipick as one of their students, alafu they have changia contribute ili nimalize my course, computer course. They took me to Sega Polytechnic. Nyanya namsaidia mpaka wananipongeza, saa zingine nimempunguzia at least uzito kidogo. Unajua kuna grandparents tena kuna great grand, they have them. Sasa mimi at least wanamsaidia kidogo. Alafu I have my nephew and sister and niece. Mtoto wa sister yangu alifariki.
The program has offered support to beneficiaries, enabling them gain acceptance within their societies and positively live a normal life.
There is something that can be done, that there is life after HIV, and that with the support of all the relevant authorities, that people can live when they are taken care of, and also when they accept that they want to live. Not everybody can stand in front of a camera and talk about their HIV status, but for us, because it is our business to ensure that we want to help people who are infected, and especially women, it was important for us to come up with a documentary that will help a wider number of people.
Vile OFAC kabla hawajatusaidia, hata kabla tujui hiyo mambo itatokea, nilikuwa ninalimia watu, ninafulia watu nguo ndio tupate pesa ili tununue vyakula. Nimeshukuru sana kwa sababu nimepata support kutoka kwa OFAC. Nina hakika nitapata chakula nyumbani. Hata shuleni wakifukuza watu ili waende wanunue uniform, mimi nina hakika niko na uniform mpya.
Action Aid also brings a component of rights-based approach, and this is basically to empower the community to know their rights and to be able to claim their rights from the government, so that they have better health facilities, they can access school, they can access their land, which is their right, and that injustice they can be able to get their justice as a result of this inheritance.
Also, just to tell people living with HIV AIDS to come out, it is only the virus that is in our body, but we are like anybody else. There are other diseases that are really life-threatening, so I don't think HIV AIDS is one of them. It is a chronic manageable disease. I think it is something that you can live with as long as you can, because I have lived with the virus for over 25 years.
To see widows spend more time on economically meaningful activities, to see orphaned children go to school happy after a hearty meal, to witness communities embrace people who were once spurned and shunned for their HIV status. This is why public confessions have endured as a manifestation of society's endeavor to change perceptions and recant its prejudices.